One, go ahead.
My name is Dr. Michael Morrissette, and I practice facial cosmetic surgery in Ventura, California. I'm here at the MAC today to learn as much as I can about different aspects of facial cosmetic surgery, and it's a pleasure to be down here in beautiful San Diego in the summertime.
Perfect. Okay, so let me ask you first, how do you feel about AI in medical aesthetics?
So I first heard about AI in January at the American Academy of Cosmetic Surgery meeting, and one of the faculty members gave a talk on it, and it was very interesting how he used the AI in sort of a time-saving manner in his practice, and it just opened to my eyes to what the possibilities could be. So recently, I'm one of the trustees of the California Academy of Cosmetic Surgery, and I was asked to revamp the website that we currently have into a new website. So part of this process is reviewing the existing wording that we have under multiple topics, and I thought this task was going to take me forever. So I downloaded the Chat GPT onto my computer, and I started looking at the different topics that I was going to have to change the information on. And it was amazingly easy to download and obtain information from Chat GPT that I could use in a cohesive way to establish my own talk on each of these topics. The information was easy to follow, was well organized, and though I didn't use it exactly, it gave me a lot of ideas. So what I was thinking was going to be multiple topics, quite a bit of time and effort. I've been basically completing about 2 different topics a day and maybe 20 minutes a session. So it's really saved me a lot of time, and it's got me thinking about using AI in my own practice as a time saver. And so I'm going to try to incorporate it more now that I've started to play with it a bit and utilize it for this website. I'm going to find other ways to incorporate ChatGPT or AI into my practice.
Awesome. What are some of the things you're thinking about doing with AI to kind of expedite your operation?
I think AI has the potential, in a good sense, to make better use of your time in practice, whether you're dictating something to your phone or whether you're, another example is I do speak and I put presentations together. And so utilizing the AI to get better information or at least verify that the information you're currently using is fairly current, even though AI is not maybe up to date completely. It was really helpful in putting together a presentation recently that I think that's the good side of it. I think the downside of it is that if people copyright the information and present it as their own, then I think that's going to be a bad side of the AI, and hopefully people aren't going to do that. But it is a very good resource to get information, and I think it will help, save time in the future as we find more ways to incorporate it into our practice.
Perfect. And one of the things I've been thinking about for AI in an applicable manner is using it to kind of do some charting, handle some charting stuff for you. So, recording the interview or the consultation you have with the patient, and potentially like just dictating that through like voice to speech, and having ChatGPT kind of separate it out for you, kind of do all that. What do you think about that as an application? What do you think about that type of usage in like, a medical environment?
I think that's another good way to record a conversation or a consultation. I think it's going to be positive in the sense that if the patient had a question about their consultation, then you could bring that back information and bring it up and show to them that you had that discussion or they asked that question. I think it's potentially going to be better than just recording a consultation. I mean, we as physicians are recording our consultation or making notes, and our notes are going to be nowhere as efficient and complete as an AI chat session. And so I think the potential as a medical record is going to be significant if we could somehow incorporate it into our current software so that you can recall a patient comes in from a year previous and they want to discuss something that they discussed previously. Maybe they had talked about it. I think it's going to be a wonderful way to record it. I think it's going to be privileged information, HIPAA protected, so I don't see a problem from that end of it. So that's a really good potential, I think, for the AI as a recording and recording a session with the patient, a consultation.
Perfect. All right. Is there anything else about AI that you want to talk about? Like maybe some of the ethical considerations, like how to make sure you're not using it poorly or incorrectly. One of the things that I'm looking to discuss soon is that there are bad ways to use AI. Like you should always fact check. You should always do your extra research. You should always be a subject matter expert. So is there a pitfall that you see that maybe doctors need to watch out for if they're looking to use this as a tool?
Yeah, I think, as I mentioned previously, if you're going to just plagiarize the information and use it in a presentation. I don't think that's proper. And you have to also understand that the AI information is possibly a year or two old, and so you may get into like paragraphs that seem super accurate and very up to date, and then you'll see a paragraph that for example, is not information that's correct or misinformation. So you have to take it and utilize it in a positive way, and not just take it verbatim and say this is going to be the information that's going to be up to date, because you have to question the information. I think we always have to question the information, and as long as you're doing that and using that AA in that fashion, I think you'll be using it in a positive direction.
Perfect. All right. I think that's good on the AI.
Yeah. One more thing I wanted to add on AI.
Sure.
Oh yeah. So last comment on AI. So bringing back this, it was a oculoplastic faculty, actually from down here in San Diego. He gave this AI presentation, and I thought it was going to be about eyelid surgery, but he was really talking about the AI. And one of the examples he gave where it was time saving was he was in the operating room operating, and he realized he had to make some notes, or he wanted to respond to some emails that he had received that he hadn't had time to get back to his computer. So in the course of the operation, he was able to get on his phone and just dictate with just saying a few words about, oh, I'm not able to attend the session that we're having because I've got a conflict. And AI created this beautiful letter for him that thanked the inviter for inviting him, and that he would like to come and speak at another time. It was a well-crafted letter in just a few words, and so in that sense, significant time savings can be had using the AI information.
Perfect. Super interesting.
Okay, so I'm going to talk next about facial implants. So I just want to talk a little bit about facial implants. Many of us, or practitioners, utilize fillers to fill voids along the face, and I'm basically doing facial cosmetic surgery. But the reality is fillers they're somewhat painful when you put them in, and they're temporary for the most part. Even the longer lasting fillers will have to be replaced. So I just want to talk a little bit about the use of facial implants in place of using fillers. Facial implants come in a number of sizes and styles and materials, and the material that I favor is a silicone material because it's soft. It slides along the bone, and it really has no feeling or contour when you touch it on the skin if you place it along the bone. So facial implants to me are a permanent way to change the face when there's voids or valleys or hollows that need to be replaced. And I like to offer them to patients after they've tried fillers. For example, they've come back in a year and they need to, the cost of having more fillers and the pain of having the injection. Nobody likes to get injected when they come back, whether it's Botox or not, and using Pronox and nitrous oxide is helpful. But the reality is people would like a more permanent change. And so in my practice, we offer facial implants, and I find it's very useful for patients, and it provides a permanent fashion. And one of the greatest aspects about silicone implants, in my mind, is that it's easily reversed. So if a patient after a year or 6 months decides that it's not quite the look that they wanted, it's very simple to remove a facial implant, whether it's chin, cheek, temporal, along the jawline. You just use a local anesthesia, and I can have the implant out. So the aspects of the silicone are going to be that it's permanent, yet it's reversible. And how many things in cosmetic surgery that we can say are actually permanent and yet reversible? So I think it's a great treatment for patients. That can be done under local anesthesia in the practice. Doesn't need a lot of OR time. It's part of the techniques that if you're a surgeon, you already basically can use the same incisions that you use for other procedures. So I'm a big fan of facial implants, especially silicone. There are other implant materials. Some of them are more rigid, and some of them allow for tissue ingrowth, and therefore they're less reversible. I do use those materials in congenital defects or traumatic defects, but as far as cosmetic procedures, I really favor silicone implants because of the reversibility of it and the ease of placement. So that's my take on facial implants. Having a great time here at the MAC. It's been a wonderful meeting so far. Looking forward to the next 2 days.
Perfect. Can I ask you one follow-up question?
Yeah.
So one of the big questions obviously patients have is cost. So I'd imagine there is a larger cost associated with implants, but can you kind of speak a little bit to how the temporary nature of fillers and why over time it might just need a better option to go with a larger implant cost?
Yeah. So let's just talk about, and one final aspect about facial implants that I want to talk about is cost. So when we talk about the cost of a filler, we know that the average cost of one syringe of filler is probably anywhere between $600 and $1,200, depending on the practice and your location. So one syringe of filler And if you have 2 syringes, you're looking at, just under $2,000. And if you have to have 2 syringes of filler per year, every year, you can see in 5 years you've spent nearly $10,000. The cost of facial implants, permanent facial silicone implants, with a surgical procedure is anywhere from $3,000 to $7,000 to $8,000, depending on whether it's a bilateral placement of these implants. So your costs, one-time costs, are going to be higher initially up front, but if you look at it, the expense over years, you're never going to have to replace them. They do not need to be removed. And so in the long run, you're going to save a lot of money, especially if you started in your 20s or 30s and decide, I want to have fillers every year. By the time you're 40, that's 20 years later, you spent maybe $60,000 on fillers, because by and large, they're all temporary. And so the nature of the silicone implant, yes, your initial costs will be higher, but in the long run, you're going to be saving a lot of money.